Kia ora koutou and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, the media editor at HINS, and today I'm joined by Sharyn MacDonald, Chief of Radiology at Health New Zealand Te Whatu Ora, Waitaha, Canterbury. So welcome on the show, Sharyn. Can you start by telling us about how and why you're exploring the use of AI in radiology?
A really key driver of why we want to explore it in radiology is basically to improve safety, improve the quality of care that we provide to our patients, and also where we can to leverage the AI to help us with improving the care that we provide to patients in terms of the ways we can influence flow of patients through the hospital, for example. So included in the mix for us is what is the role of AI in triaging of unreported images. So there are AI solutions available, for example, that would look at a big unreported work list. And of the types of studies that the AI can be applied to, we'll go through and work out which of those studies have abnormalities on them and adjust the triage flags on our work list to help us to identify which patients need to be reported with priority potentially over other patients. I think the other big role for AI along similar lines is in consistency of reporting. It's very consistent at detecting abnormalities, and a good example is potentially in lung cancer on chest x-rays. It's something that could improve detection of small nodules on chest x-rays that may be lung cancers. We know that we miss them on chest x-ray. There's an error rate, and that the AI acting as a co-pilot alongside of the radiologists may help us to improve the detection of lung cancer. And also there are tools available as well, for example, for things such as fractures, and improving the detection of fractures, whether it's because it's helping out in the emergency department ahead of a radiologist ever seeing the films. It might be something that emergency clinicians and orthopedics can have access to help them to identify fractures. Often out of hours, it's more or less experienced staff that are actually looking at a lot of the imaging and making decisions. So again, in terms of improving safety and quality and consistency of care, these solutions never get tired of looking at x-rays or CT scans if that's what you're using them for. So probably for me, safety is a really big one. Safety, quality of care, and in turn helping us to improve the service that we provide, enhance patient flow.
So are there any pilot programs or small-scale tests due to start this year to assess the performance of AI in radiology across New Zealand or in Canterbury?
So Canterbury actually already has some older AI solutions active. It's got one that looks at chest X-rays to look for something called a pneumothorax, which is air around the outside of the lung. It's also got one looking CT of the head to see if there's any blood in the brain, and another tool as well that looks at CT chest. So in terms of trialing, those solutions have been in use for some time, but the next generation or current generation of AI tools actually look for a lot more findings than that. So the ones that we have look for one finding each. Some of the newer solutions will look for over 100 findings. So we're very keen to understand how those solutions could be integrated into our workflow and enhance care. At this stage, we don't have firm plans for piloting. We're trying to navigate that as a system to work out how we could actually pilot some of these newer solutions. And the ones that we are looking at are ones that are applicable to some of our most common, highest volume exams. So again, chest x-rays, which are done for patients both in the emergency and inpatient setting, but also in the outpatient setting, fracture detection, and also looking at, again, CT brain as well. So by looking at solutions that are really for the highest volume exams, we have the potential to help a large number of patients, but we don't have timeframes yet for piloting these newer solutions within Health New Zealand. Some of them are in use in the private sector already in New Zealand, and including to provide care to Health New Zealand patients. So we have the opportunity to potentially learn from the experience of our private provider colleagues in that regard. And then also in the UK, the NHS has made available to its radiology services some AI solutions, including some of the ones that we're quite keen to pilot in New Zealand. The ones for fractures, the chest x-ray ones are the two that spring to mind that the NHS has already got in use.
Great. Yeah, it's always good to be a fast follower, isn't it? And presumably, not only will it speed up the care for those patients themselves, radiology also, key part of the workflow when people are in hospital and we've got issues around getting people both into beds and then out of beds. Would you say that, faster flow of radiology is going to have that wider impact across the sector?
Yeah, so the most obvious target that radiology contributes to is the shorter stays in the emergency department, where patients will have a delay to get their imaging done, but then also potentially a delay to have their imaging looked at, especially out of hours. And what these solutions offer in that context, in some cases, they may be, as I said, made available to the emergency docs, but in other cases, they can help the radiology staff that are on out of hours to actually triage what they look at first. We need to be careful that we don't disadvantage patients who've had something imaged that doesn't have an AI solution that can look at it. But I think the using the AI solutions, if we get this right, we have the opportunity to make choices about how we prioritize the work that we do and in turn help to enhance safety overall, both for the patients who have had their imaging looked at by an AI solution and also those that haven't.
And another big issue for the health sector and radiology in particular is around workforce. What do you see as the potential? Obviously, the human's still going to be involved in all of these pilots, but what do you see as the potential for AI to help with sustainability of radiology services given workforce shortages globally?
I think they're going to be critical going forward, especially on the reporting side of things. Many of these solutions, just to clarify, we already have the spectrum of machine learning through to AI in the image acquisition space. But I think most commonly when people talk about AI and radiology, they're thinking about it in the looking at the images, interpretation and reporting space. And one of the solutions that we already have automates the measurement of a number of things on CT chest scans. So that saves the radiologist time and enhances consistency. So I think the incremental gains from implementing solutions that enhance our ability to triage the work that we do, potentially reduce the interruptions because we've dealt with the abnormal work, begin to automate processes that currently require manual interaction by the radiologist, will release their time. And the evidence is mixed, but in at least one of the New Zealand contexts, the fracture detection solution has been found to save time. And interestingly, talking to colleagues who have used AI solutions in the private sector, one of the ways it saves time is when they think a study is abnormal, if they then check and the AI has also thought that the study was, sorry, normal, and the AI also thinks it's normal, people are reassured to move on without having to take a second look at things, which saves them time. So I think we're still learning on how it might help our workforce, but I think helping triage the work that we have to do and then helping automate processes like measurements, which we'll increasingly do with time, will help. And then some of the newer solutions too are beginning to draft sections of the report based on the content that you have dictated, or they're actually starting to draft based on the findings that the AI solution has made, some of the report content as well. And I think as that gets better and better, that will also save us time. The important thing to realize about the AI solutions is they only look for what they've been trained to look for, which is limited, but it's a really good start trying to address the challenge of increasing demand with workforce constraints.
And so, if you do move ahead, and obviously you're learning lessons from other countries, but what monitoring process do you think would need to ensure that our AI tools remain safe and effective?
I think we need to be thoughtful about what we choose, and then at this stage, certainly these tools are co-pilots, or they're working alongside a radiologist, not instead of a radiologist reporting. And so the duty of care for any given patient still sits with the radiologist in terms of making sure that they have reviewed the images and reported on the findings appropriately. I think we are looking at solutions where we do have the opportunity to provide feedback to the vendors, and we're increasingly seeing that the AI vendors have incorporated the opportunity for the radiologist to indicate whether or not the AI helped them, or indeed whether they felt the AI solution missed something that it should have found. I think we are on a journey as a specialty with regard to learning how we might in a more sophisticated way, monitor the performance of these tools, including across different ethnicities as well. The tools are often trained on a particular training set. We do need to know how they perform with our population, but I think one of the things to bear in mind is that for some patients at the moment, no one is looking at their images, and an AI solution in that context may actually be a lot safer, screening the unreported exams and highlighting those that it thinks are abnormal than having no one having got to those x-rays yet or that scan yet because of the workforce shortages.
When you talk about AI tools, are they usually integrated in part of the machines, or are you talking about sort of standalone tools that are integrated then into the pathway at some point, or is it a mix of the two?
It's a mix, and actually, globally, what people are looking at with AI and radiology is really from end to end, from helping people make the right decisions around what imaging to refer patients for, helping with triage, scheduling, helping with image acquisition and processing, and helping with reporting, which is most of what we've touched on today. So it's actually quite pervasive across the whole patient journey through radiology and everything we do. And I guess that's a reflection of how AI is increasingly becoming integrated in our lives in general. We're seeing AI solutions turn up in many different places. We're all on a journey together in terms of how AI is going to help complement our human workforces and improve and enhance our human experience and outcomes for our patients where it's being applied to healthcare. And the key thing is making sure it does no harm, and that it is actually enhancing healthcare. And I think it's a duty of care that we will all have over time to work out how to work out that these solutions are delivering as intended to our patient populations and are things that continue to improve and don't have unintended consequences.
Just following on from that, finally, you're obviously a clinician. Why is it important to have clinicians like yourself directly involved, from the very start of the process, but when you're just thinking about what tools you might implement right through to the end to ensure that AI is bringing value to radiology, and I guess IT is being done with you rather than to.
I think part of it is because we have a good understanding of what the tools are capable of versus what they need to be capable of if they're going to substitute for humans. I think it's very attractive at times for people to think that workforce shortages can be addressed by using solutions like AI, but they have their limits. And it's often the people with the specialty expertise that really understand the gap between the capability of the AI opportunities that we might have versus the reality of what they need to have. They vary in what they can deliver. I don't think there's necessarily one size fits all for which AI solutions might be best for any given district in New Zealand or our population as a whole, because the needs might differ in different parts of the country as well. Some places are relatively well staffed and other places are not so well staffed. And so, how they may choose to use AI and which tools they might choose to implement might differ. And I think at every point in that decision making, there should be a clinical voice in there to make sure that the solutions are the right one for the problem that any given service is trying to solve. And then I think we also need to be really thoughtful about how these solutions are integrated into our workflow. And they need to be integrated into our workflows in a very seamless way so that our workforces can continue to work efficiently, effectively, safely, delivering care to patients. The last thing you want is something that steps them out, for example, of patient context or requires them to go through a whole separate and time consuming process. You really want it to be something that seamlessly integrates with the existing tools that we use and complements rather than creates a problem for clinical care in terms of implementation.
Well, on that note, I will wrap it up. Thanks so much for your time and your insights today, and definitely look forward to hearing about those pilots as they go live, and we'll continue to report on it. Mā te wā.